Good morning, everybody, and thank you for joining us today for our webinar on using technology to help treat young people with mental ill health. We're very fortunate today to have Dr Carr-Gregg joining us to deliver this webinar. My name's Karen Marriage. I'm a clinical psychologist and I'll be acting as your moderator for the day. Just might start with an acknowledgement of country. Orygen, the National Centre of Excellence in Youth Mental Health, together with the Young and Well Cooperative Research Centre, wishes to acknowledge the traditional custodians of the lands across Australia on which our webinar presenters and participants are located. On behalf of its webinar presenters and participants, both organisations pay respect to past and present elders of these lands and extends their respect to other Indigenous Australians who might be present at this webinar. Okay, so this morning we're joined by Dr Carr-Gregg. He's one of Australia's highest profile psychologists. He's the Managing Director of the Young and Well Cooperative Research Centre, which is committed to exploring and understanding the role of new and emerging technologies in the lives of young people. He's an author of 9 books. He's on the board of the Australian Psychological Society and he's a member of their e-psychology special interest group. He's the resident psychologist on Channel 7 Sunrise program, as well as a psychologist on Macquarie Radio and 3AW. So I think you'll agree that if we're thinking about technology and young people in the mental health sector, we're in very good hands this morning for the webinar. Okay, for those of you who have colleagues possibly who couldn't be here at the right time to see the webinar live, it would be worth you knowing and letting them know that it will be recorded and available at a later date, hopefully before too long, at the Orygen website. So if you want to come back to some of the information that you've seen today, or if you have colleagues who you think might be interested in viewing the webinar, do come back and have a look at the Orygen website and you can review the webinar from today. If you haven't done one of our webinars before, you should know that you're able to type through questions for Carr-Gregg. On the right-hand side of your screen, you'll see a little white box. There's a text box where you can add a question in there. We'll do our best to get to them. We're not sure exactly how much time we'll have to answer questions at the end of the webinar. We'll do our best. What you can do is send them through anyway, or actually to Twitter. Michael has kindly agreed to give you his Twitter handle. So if you do have questions that you're not able to get answered today during the webinar, you can send them through to his Twitter handle, which we'll give you at the end of the webinar. Also worth knowing that any questions that you do send through can only be read by us here, the moderator and Michael, so they won't be able to be reviewed by other participants. And we also have the capacity to be running a poll, which we'll do to start the webinar today. Okay. So let's get into it. Today's webinar will run you through some of the latest research into mental health problems in Australian young people. It'll give us some information about how young Australians are using technology, and we know that they're using it in enormous numbers. So if you're of an older vintage and working with young people, it really is something that we're needing to be up to speed with, because it is what the young people of Australia really are doing. We'll examine the role of technology in helping young people manage their wellbeing. And we'll think about a new model of mental health care, and we think you'll find it quite interesting and exciting. If you are working in this space, there'll be some information in here that'll be very practical for you in helping you to work with young people in the technology sphere, which is where they're up to. It's what they're doing. Okay. So we're going to start with a bit of a poll question, and we thought we would just like to get a sense of who you are and what your professional background or your interest is in this topic area. So if you could just spend a minute now answering for us what your main role in helping young people with their mental health is, whether you're from the education sector, whether you're a wellbeing or a counselling type professional, a mental health clinician, or possibly a family member. We know occasionally we do reach a pretty broad audience, and sometimes we get family members or young people themselves possibly registering for our webinar. So if you could spend a minute letting us know where you're coming from, that will help Michael to get a sense of who's logged in today.
Wow, well, look at that. We've got about 40% wellbeing support people or counsellors, and about a third, just under a third, mental health clinicians. Sadly, no family members. and a good sprinkling from the education sector, which is good. I'm always fascinated to know who the others are. Anyway, hello, it's Michael Carr-Gregg, and thank you for that warm welcome from Professor Karen Marriage. I'm looking very much forward to taking you through some of these really interesting components of the webinar. So my slides seem to have disappeared for a second, so I'm just going to get them back. Karen's going to do this, being Generation Y herself. Might actually need some help. They've just...
I wonder if we can see them. If we...
Oh,
there we go.
There we go. Beautiful. Okay, they're back. Wonderful. Terrific. Okay, so we'll kick off. Now, a lot of the components of this particular webinar are contained in a world-first online certificate known as the Certificate in Young People's Mental Health and Technology. And this webinar is really very much almost a teaser for that. And if you want more information around any of the aspects that we talk about, you really need to do that webinar. And Karen will explain to you how you can enroll in that webinar. It's continuous enrolment a little bit later on. So one of the first and most important modules actually looks at what does the research tell us about mental health problems in young people. How are they actually going? And while the actual module covers virtually all of the key points, I just want to take you through a summary of that. There are a lot of very, very good reports, evidence-based, online that you can actually have a look at. But the one that really impresses me most is the Youth Mental Health Report done every year by Mission Australia. And they've actually been doing this with 15,000 15 to 19-year-olds since 2002. And it really is a very wonderful way to almost test the temperature of what's going on in young people in 2016. Last year, they did just under 15,000, and they actually came up with some very interesting results. So what are young Australians worried about? Well, interestingly, one of the most important issues for them is coping with stress, followed by school or study problems, which shouldn't be a surprise to any of the educators looking on today. Body image, the whole concept of young people feeling that they're born into this giant beauty contest in 2016. And of course, highly unsurprising, depression, which of course is one of the major factors in both attempted and completed suicide. So we look at the percentages that have seemed to grow year after year after year. And if you look at this particular diagram, you'll see that the percentage of young people either extremely, very, or somewhat concerned with these issues seems to grow the whole time. So over 2/3 are worried about coping with stress. Just under 60% are worried about study problems, about half body image, and about 1/3 depression. These figures have grown year after year after year. And what this says to me is that whatever we're doing isn't necessarily working that well, that young people aren't necessarily managing their well-being as well as they can. When it looks at pure research on mental health, what we find is, again, very interesting, this big telethon study done out of the University of West Australia, the largest ever survey of youth mental health that looked at over 6,300 families. They actually found 1/4 of girls aged 16 to 17 had actually engaged in self-harm, with 1 in 5 meeting the clinical criteria for major depressive illness. When it looked at kids, we found 1 in 7, 1 in 10 were self-harming. Again, I think a really good indicator of their lack of coping skills. And 1 in 40 had actually attempted to take their own lives. So whichever way you look at it, it doesn't paint a very good picture. The problems aren't going away, and they don't seem to be responding to a lot of the conventional ways in which we seek to address this. Again, going back to the issue of self-harm, this is just from New South Wales, looking at the cases of self-harm amongst young women aged 15 to 24. This was actually on hospital admission. So we're not talking here about just scratching across the radial artery. We're here talking about really quite substantial problems in self-harm, and it's doubled essentially since 2000. Self-harm amongst Australian young people We've now got figures from Dr Carr which tell us that over 9,000 young people were hospitalised due to self-harm. The rates for women, 2.5 times higher than those for males. Our Indigenous people, aged 15 to 24, are a staggering 5 times more likely to be hospitalised. And about 1 in 10 young people across the board have engaged in self-harming behaviour. And we have specific groups that we're particularly worried about. I highlight here not only our Aboriginal and Torres Strait Islander people, but also the LGBTIQ community, which I'm very, very concerned about. When we look at some of the more recent results, and this only came out a few days ago, a very interesting report put out by Kids Helpline showed there'd been this staggering over 600% increase in calls about mental health since 1996. And I think this says two things. One, how wonderful that Kids Helpline exists and that we've got the 1800 number, but how the number of people calling around mental health issues has really skyrocketed in a very short period of time. Interestingly, about 246% of those was an increase in call about suicide. So this is, again, pretty much the pointy end around adolescent mental health, child and adolescent mental health. The other issue, of course, is suicide. And if you want to get the attention of people around adolescent mental health, people often talk about suicide. The reality is that in 2014, the year that we've got the latest data for, Australia actually recorded its highest suicide rate in 13 years. Nothing to be proud of, and something that I think really does need to be examined. What you have to remember about this is these are just the ones that are reported by the coroner. The actual rate might be, in fact, much higher, and there are many people who argue that it is. Looking at these statistics and seeing what we're seeing, for some reason this has just got stuck. I'm just waiting. Oh, there we go. The World Health Organization basically reassures us that it's not just in Australia. Right around the world, we've got about 800,000 people taking their own life each year, and that's about 1 every 40 seconds, and up to 25 times as many again make a suicide attempt. So there's lots of work to be done worldwide. Back to Australia, you'll see quite clearly that suicide accounts for more than 1/3 of the deaths amongst Australians aged 15 to 24. And speaking about the certificate, we actually have in the certificate in young people's mental health and technology a particular module that focuses on how technology can be used to deal specifically with the issue of suicide and self-harm. And that's my second favourite module. My first I'll talk about later on, which talks about how to integrate technology into the clinical practice that you actually have. So what we have now is quite stark data, which should really get your attention. Young women in particular recorded one of the largest jumps in suicide rates since 2005. We're talking 50%. Yes, the 55 to 64-year-old women also had a significant increase, but we do need to recognise that about 50% of all the psychological problems in young people actually start under the age of 15. So we need to really focus on prevention and on building wellbeing as a way of reducing these really quite horrendous figures. The Age last week pointed out that as many as 4 million people in Australia were experiencing mental ill health right now, but only 1/3 of the population had access to treatment. Now this is very important because of one of the great benefits of technology is it can help overcome a lot of the geographic, financial and attitudinal barriers that actually are stopping a lot of people from obtaining the treatment that they need. So that's one of the huge advantages that we see coming from the use of technology. Now, technology, I think, can be a solution. And the reason I put this slide up is I can remember back in the day being terribly excited to get a USB stick that had 128K on it. I want to point out to you now that you can actually get a USB stick now with 1 tetrabyte on it, which is just extraordinary if you actually think about the speed and the change in the internet over time. The reality is that the reason why mental health professionals, particularly those working with young people in health, education and welfare, need to be using this technology is because it's becoming ubiquitous. There are about 3 billion people online. That's 43% of the world's population. When we first started talking about the first iteration of the certificate, it was actually 41%. So just in the period of time that the certificate has been in existence, it's gone up 2%. And they're arguing that about 70% of people on Earth will be covered by 3G broadband by the end of this year. And it's growing. The number of websites hit 1 billion in September 2014. And that's really frightening because there's one new website registered every single second. And sadly, about 30% of these websites are porn websites. But there is, of course, a substantial upside to the technology, which, of course, the media often don't focus on. The other thing about this is it's getting faster. If you go to South Korea next year, they will launch the world's first 5G service. Now, I want you to think about this. People in South Korea next year will be able to download an entire high-definition movie in just 1 second. There is apparently technology afoot in the States which is going to allow people to download 250 high-definition movies in 1 second. Why you would want to do that, I'm not quite sure. But clearly, the technology is becoming faster and more efficient. And I think that mental health professionals need to get on side with this. We need to start thinking about how we can use this faster and faster technology to our own benefit. Right around the world, we are seeing changes. E-mental health programs are being used in a lot of developed countries because they see the advantages in getting information out to the masses very, very quickly in a cost-effective and very effective way in terms of the treatment outcomes. This is more accessible, particularly for people in rural and remote communities. It allows people to stay in control. They can actually do their own thing at their own time. And of course, it does help overcome one of the big problems when we talk about young people and mental health, in that they are particularly concerned about their privacy. And very often, a lot of these programs that I'm going to show you are very youth-friendly. They're very engaging. And the great thing about them is that they're stigma reducing. When we ask young people, for example, about how many steps they've taken or how well they're sleeping, that's not very stigmatizing. That doesn't actually trigger the, oh, I don't want to talk about my mental health button at all. The other thing that's very clear is that when we look at the use of technology by Australian young people, we've now got clear evidence that just about all of them have a mobile phone. Many of them have smartphones. Even kids who come from quite impoverished backgrounds seem to be able to get their hands on smartphones. It's quite extraordinary. And about 91.89% of them have downloaded an app. They are the #1 group to download apps. To them, when I ask a client to download an app, it is not an aberration for them at all. It's something that they're very, very comfortable with, and it's not at all jarring. The other thing that was so interesting last year was that the Australian Communications and Media Authority released this data looking at who owned smartphones. What we look here, we see 14 to 17-year-olds. So we're talking here about early to middle adolescence. A staggering number, 80% in June last year, it's probably much higher now, actually owned their own smartphone. So it kind of makes sense to me intuitively that we need to harness this uptake by young people, particularly those of us in Australia, because we are clearly early adopters of a lot of technology, and incorporate it into our efforts to improve their well-being, but also to treat the high prevalence disorders of depression, anxiety, and of course substance abuse. And why would you use technology? Because it matters to young people. They do not make a distinction between the on and offline world. These young people see it as seamless. It's how they communicate. Very interesting to think that this is a generation that has actually never known a world without computers. And of course it provides them with that flexibility and that confidentiality, removes those barriers I talked about earlier. The other thing is that this gives us, if we can harness this technology, an unbelievable opportunity to get real-time, standardized health and wellbeing information, which is accurate, up-to-date and reliable, directly to young people in their natural environment using their smartphones. Now, what you have to remember is that young people, by their nature, are not particularly sophisticated consumers of mental health care services. Therefore, it is much better that we bring the information to them in their natural environment than expect them to access it by coming to us, because essentially our offices are only open 9 to 5. Remember that. So what I wanted to do is take you through part of the third module of the certificate, which looks at how technology might in fact work when it comes to improving the well-being of a young person. I want to take you through a hypothetical case study. I'd like you to meet Georgie, who clearly doesn't exist because she's an avatar, but she is about a 15 to 16-year-old girl, and she goes to a state school somewhere in Melbourne, and basically she is very fortunate because she's going to use a new system, and it relies on her, like 98% of her, having a smartphone, which of course she does. And one of the wonderful products that the Young and Well Cooperative Research Centre has created is called Happiness Central. And I want to take you through this really fantastic system and take you on this hypothetical course. The first and most important thing you have to understand is that by the end of next year, we're hoping that most schools will have access to Happiness Central, which by the way is being trialled at the moment. On enrolment, Georgie gets to download a specific white-labelled school wellbeing app. So whatever school you attend, can you imagine, insert your school name here, app being available for young people to basically download. And when I'm talking about young people, I'm talking here about adolescents. So the Australian Medical Association definition is 15 to 20, it's 12 to 24. So that's what we're talking about in terms of these kids. The data on the actual use of the apps is available from the Australian Communications and Media Authority, and they've actually got a report which shows that a lot of these young people are in fact downloading these apps far more than in fact anyone else. So what this particular app does is Georgie basically is asked a series of questions about her well-being. It might focus on her health and fitness, her sense of independence, her relationships with other people, her thoughts and emotions, and what's going on for her at the time. Having completed this particular questionnaire, the app then does something really amazing. In a world first, it creates a personalised, customised wellbeing plan and recommends to her specific evidence-based apps that are what we call Mars rated. Mars standing for the Mobile App Rating Scale, which of course was developed by the Young and Well CRC with our friends in Queensland. And what we have now is a quite revolutionary, I would argue, game-changing system whereby young people will have on their phone a whole range of apps and web-based programs, some information that will help them manage their well-being. So again, hypothetically, in response to what Georgie has told the app, what is she basically learning? Well, basically the app figures out Georgie's main issue at the moment is sleep. Now that shouldn't come as a surprise to any of you, because we are undeniably in the grip of a kind of nationwide teenage sleep deprivation pandemic. The research is quite clear that young people should be getting 9 hours, yet most of my clients in fact get very, very few, much less, probably about 6.5, sometimes 7 hours. So in fact, the fact that Georgie isn't getting the sleep that she requires is totally not a surprise. So we look at sleep and we wonder what we can do. It is, without doubt, the single most important behavioural experience that we have. The average person will spend over a third of their life sleeping. And so the first thing that Georgie gets is some guidelines, some accurate information on, well, what does the research say about how much sleep that she needs? she might get a fact sheet from Orygen, a link to that saying, Georgie, here's some information so you can actually get some reliable information about this. You get some information on relaxation skills, coping with stress, and I can commend to you all of the fact sheets that Orygen put out. I really do think that they are brilliantly written, very colourful and fantastically useful. I frequently send these to my clients, but the beautiful thing about this is that she hasn't had an interaction with a health professional. All we know is that she's not sleeping well, so she gets this information. But remember, of course, Georgie might not be somebody who prefers her information in a written style. So the app will also offer her a TED talk from Professor Russell Foster from Oxford University. He's the Professor of Sleep Studies there. And this is a brilliant TED talk. If you have never seen a TED talk, this is the TED talk that you need. It is psychological gold and very simple to understand, gives practical evidence-based strategies on sleep and how to get a better night's sleep. So it's gold. The other thing that should be offered is a recharge app. Now, this was an app developed by the Young and Well CRC. It's a free app and I love it. This app is a 6-week sleep course, what I call beducation. Terrible pun, but it basically allows young people to learn about their sleep. You can see on the right hand side it says do 10 star jumps while holding your phone. It will wake you up with a Tarzan yell. It will basically give young people practical tips to improve their sleep-wake routine, get daily reports to track their mood and their energy, exercise and sleep, and she can view graphs to help her monitor her progress, all of which can be reviewed in each session. But Georgie's also got a Jawbone Up, one of those wearable devices, and that was recognised by the Happiness Central app. And what that does is it feeds in all the information that she downloads about the number of steps she does and how she sleeps into the Happiness Central app. So using the Jawbone tracker, which remember has an accelerometer in it, we can actually tell how she's sleeping. In the morning, it'll download automatically this information onto her telephone. And from this, we can tell she only slept for 6 hours and 20 minutes. We know that it took her 10 minutes to fall asleep. But we also see the time that she spent in REM or rapid eye movement sleep, deep sleep, dream sleep, wasn't really sufficient. She went through essentially 5 sessions of sleep, during which time, remember, the brain is restoring itself, it's conserving energy, but most importantly, it's helping her process the information that she learnt at school. So sleep is without doubt the most important study tool going around. And this is a very good way that she can begin to learn about sleep and associate sleep with the other activities that she does in life. This happens to be the Fitbit dashboard, a little bit different, but again, same thing. Some young people prefer Fitbits to Jawbones, and I don't really care what they use. The app will basically feed into both pieces of information. Now, amusingly, her major concern is about her snoring, so it offers her a very unique app called Snore Lab. Now, I know this will be massively downloaded after this wellbeing seminar. What I can say to you is that this literally sits by her bedside and records her night's sleep. So you can see that she started at 9:30, she woke up at 4:45. It monitored for about 7 hours, but she spent 2 hours and 40 minutes snoring. She gets a snore score of 59, and you can see that it was really quite loud. It wasn't epic, which is sort of A380 taking off noise, but it was loud enough for her to be concerned. So she's encouraged to take this to her GP. Her GP incidentally refers her to a sleep clinic that recommend a dental device, and some days later, about 11 days later, she's using it again, and you can see sleeping much, much better. Her snore score has dropped from 59 to 17. Really quite a substantial improvement. So go for it. Snore Lab is the one. Now, the other thing that this app tells us is that she's clearly not eating breakfast, and she's not alone, because we've got evidence now that about 32% of students skip breakfast before school. Now, remember, the sole source of energy for the teenage brain is glucose. Glucose comes from carbohydrates, and in order for the 100 billion brain cells, the 1,000 trillion connections, and that 25 watts of electricity that should be generated by the brain to do that, the brain needs to be well fed, well hydrated, and well rested. So she's going to get some information around this. We know there's a difference between boys and girls. The boys are just chronically disorganized, which shouldn't surprise any of you, but the girls often miss breakfast because they think that doing so would help them lose weight. So Georgie gets some information that basically says, well, no, actually that isn't the way it works. She gets directed to a website about breakfast, and she's taught that basically breakfast is the most important meal of the day, and if you do in fact eat breakfast, you end up eating a lot less during the rest of the day. So she gets some really good nutritional advice, which hopefully she'll take on board. The other issue is that she's actually eating too much junk food, in fact a lot of junk food, and the response is the app tells her about an amazing piece of research done by Associate Professor Felice Jacker from Deakin University, which actually shows the importance of the mood-food link. And it basically tells us that diets which are high in processed foods, soft drinks and sweets, are in fact, and this is revolutionary, linked to an increased risk of behaviour and emotional problems. We know that people, adolescents scoring much higher on a measure of healthy diet are less likely to report symptomatic depression. But if you have an increased consumption of junk food, you're more likely to report depression. So I think this is a really important piece of information for her to have. So she learns about, well, what is a Mediterranean diet? She learns about the importance of eating fruit and vegetables, whole grains, legumes and nuts, and replacing butter with healthy fats such as olive oil and herbs and spices instead of salt. So again, no one's telling her, wagging their finger in her face, telling her what to do. It's the provision of information, which I think is very, very useful. She'll get an app, a marvellous app, that basically tells us a lot about Mediterranean lifestyles for dummies, Mediterranean diet plan. There are about 30 different apps on Mediterranean diets, all of which she can learn about. Now, the other problem that she's having is she's pretty anxious. So she actually, that's been picked up by the app. So she gets offered a specific fact sheet on anxiety from the wonderful people at Reach Out. Now, nobody does fact sheets on the high prevalence disorders as well, I think, as the Reach Out people. God bless them. And this is a fantastic example. The language is clear, it's beautifully written. And again, nobody's saying you have to read this stuff, but it's one way that she could get the information. There are obviously other things that she could do. She could click on the links that will be provided to her by Beyond Blue and see a whole lot of videos on anxiety, and that's another way that she can get that information. Excitingly though, she has a free evidence-based online treatment program to do in her own time. Now, Mood Gym has been around for 20 years. Did you know there have been 17 different studies on Mood Gym? There have been 4 randomized controlled trials which show that for mild to moderate depression and anxiety, this web-based program is highly effective. So again, this is for someone like Georgie who might be in a rural, remote community where she doesn't have a hope in hell of accessing clinical services. This is something that she can do on her own time in the privacy of her own room. She also can be offered a link to a pamphlet from Beyond Blue for her parents. Very many of my clients who have anxiety and depression are loath to talk about their problems with their mum and dad. This is a fantastic way that she can give the information directly through to her mum and dad. It might even suggest some wording for an email that will help her allow her parents to understand the nature and extent of her problem. Even better, because Georgie's started to have some panic attacks, it recommends a fantastic app, probably my favourite app at the moment, Reach Out Breathe. This is an app which actually uses the phone camera to actually take the pulse of the young person. And this is fantastic because it allows them to slow their breathing down and use very, very similar techniques that we would use clinically, such as diaphragmatic breathing, to get them to manage their own panic attacks. Brilliant. She'll be invited to do some evidence-based online treatment through the BRAVE program, University of Queensland Beyond Blue. This is an interactive online program for the prevention and treatment of childhood and adolescent anxiety. Again, programs are free and gives young people the skills that they need to better cope with anxiety. Well worth having a look at if you've not visited it. She might also get to use an app that uses acceptance and commitment theory to help her deal with her anxiety. Worry time is about postponing the worry, and you know, for people who ruminate, people who have difficulty distancing themselves from the power of that anxious thought, this is a fantastic app. Again, free, well worthwhile, and from people at Reach Out. We know that Georgie is still very, very stressed, so she actually gets offered a mindfulness meditation app, Smiling Mind. And disclosure, yes, I'm on the board of Smiling Mind and therefore have to disclose an interest. But we're a charity, we make this available. Did you know we just had our millionth download? Very, very exciting. So this is an app that I love because of this. It is developmentally correct. It actually does something that I don't know any other app does. It actually breaks the app content into, for children, for early to middle and late adolescence, and then on to adults. That I think is brilliant. And clearly the fact that 1 million people are using it, many schools across Australia are now using this, it works well. But she wants some evidence base on this. She receives information on mindfulness. There's a little link she can click on which talks about this study that was done at Harvard University, which showed the results of just 27 minutes a day, actual changes in the brain's grey matter, major increase in grey matter density in the hippocampus and a reduction in the amygdala. Now, no one knows precisely what clinically that means, and it would be wrong to say that they do. But clearly what this does show is that mindfulness as an independent variable does seem to create some very, very interesting changes in the brain. That's got to be explored more, and it will be. The other thing that Georgie might get offered is a little device called the PIP. This is a handheld device. It uses galvanic skin response or electrodermal activity to basically monitor her the amount of electricity going through her body at any time. She sets a session on the free app that goes with it for 15 minutes. This particular app then allows her to see, to visualize on her phone how stressed, how relaxed she is. The more relaxed she is, the more green screen, the more stressed she is, the more red. When she finishes the exercise, she actually gets a session result, breakdown, a score. And the idea when I'm working clinically with kids using the PIP, which you can get off the internet, is that she tries to improve her score every single time. So that's very, very exciting. The other way that you could do this is by paying $110 and downloading the software for free. This is called eSense. Again, same type of system, you just attach it to your finger. Do you know, I'm so old that I remember in universities we used to have whole rooms which contained equipment that did this biofeedback, and now you can hold it in your hand. God, I love technology. Here I've got my clients to squeeze their hands very tightly together and then relax and squeeze and relax and squeeze and relax. And you can see the measurement curves in live time. It's great. Look, there are a whole range of biofeedback devices now. The Melon headband needs to be explored if you haven't seen it. The Muse, these literally read the brainwaves and display them in a gamification style. And again, about $250, downloadable from the United States, and the apps are all free. But these are the sorts of things which I think are really beginning to make a big difference. The other issue, of course, is that like many young women, Georgie just simply isn't getting the steps in that she needs to. The article in PLOS basically said that if you've been working doing 1,000 steps and you increase it to 10,000 steps, then what we see very quickly is that people can improve their life expectancy by about 67%. So she receives a fact sheet from our good friends at the Black Dog Institute on exercise and depression, but she also gets an app that can help her with her exercise. I love this app, Couch to 5K. You actually are asked to download some music, because if you exercise and do listen to music at the same time, apparently you exercise for longer and harder. And what this does is basically get her to do a little 5-minute warm-up, then to run for a minute, walk for 90 seconds, then run, then walk, then run. She does that 6 times, and very gradually she builds up till she's literally running 5K. She can send the people in her life the information that she's done this, either on Facebook, Twitter, or by email, and of course the app will send her encouraging messages when she's completed the session or week of 3 sessions, which is very exciting. So this is a great way to get them out there, oxygenating their brain, getting some vitamin D, all good stuff for well-being. Georgie tells the app that she's worried about a friend, and the app responds by offering her this brilliant app from Beyond Blue. This is an app which helps young people take the fear out of having that conversation with their friend who might be struggling, and it gives them a whole range of advice. It basically tells them 4 super easy and super quick steps to help her think about where she might check in with her friend, what she might say, and how she might support her friend, but more importantly, what to say if the friend says, no thank you, I'm not very interested. Now remember that one of the greatest predictors of well-being for young people is not being good looking, not having more positive life experiences than bad. It's actually about having a rich repertoire of friends. So if we can give them apps to help them to obtain, retain, maintain friendships, well, that's got to be good long-term for their well-being. But she also has started to smoke a bit of weed, and she wants some help to cut down her cannabis use. So the app recommends a fantastic web-based program put together by the National Cannabis Prevention and Intervention Centre. Don't know if you've seen this. This is one of my favourite apps. I've actually used this in clinic with my clients, and it uses motivational interviewing. It's just so clever. They choose a character that most closely relates to them, and they're taken through literally a do-it-yourself guide to quitting cannabis. Marvellous program. Have a look at it. I love it. Georgie's life is not getting any better, and it's a good thing that she's actually a hypothetical person, because I don't think she'd be very happy around about now. But her relationship has in fact broken up with her partner. But the good news is she can get my second favourite app of all time, an app called Breakup Shakeup by the Young and Well Cooperative Research Centre, put together by the good people in Queensland, again at QUT. And this app I adore. It gives her fun, easy things to do to help her cope with a relationship breakup. So it teaches her that planning activities and increasing her social support will actually help her cope much faster. So it offers her a category of ways in which to de-stress, being cheering up, energized, taking her mind off it, whatever. Let's say she clicks on de-stress. What she sees is a whole range of different options which can help, and she can choose one or all of these to help her cope. And I don't know about you, but all of us have had probably a relationship breakup at one time or another. And I can remember growing up in Sydney for 1 hour in the Edgecliff post office over a relationship breakup that I had. I hope she's watching. Problem 10, Georgie's mate is self-harming. So she's not self-harming, but she's worried about a mate who is. And what she does, the app recommends an app called I Cope. Now this is developed by mental health professionals in the UK, and it offers her and her friend an alternative to deliberate self-harm. Now, a lot of people will find this very challenging. What I like about it is that it actually gives her the opportunity, her friend, an opportunity to rate how bad she's feeling. So if she's just got fleeting thoughts that don't last too long, she'll click on the green button and it'll offer her some distractions. What I don't like about this app is that this part isn't customizable. And I think if you were going to do this, you'd want to have a great deal more customization. I'm currently involved in a project which is actually going to be creating certainly Victoria's first ever youth suicide prevention app, and I'm very, very mindful of what works in some apps and what doesn't. The other thing is she may feel that she has strong feelings of harm, and she makes plans that are hard to resist, and again it gives her specific strategies that she might use to deal with it. Again, I prefer this to be customizable, and I think anyone that was thinking about creating one would want to make it that way. And the last option is the most controversial. She makes plans to harm, and she doesn't feel able to resist them. So what this app does is it gives her an opportunity to either cut or burn herself virtually. Again, very challenging. So how does she do this? It gives her a virtual arm, her left or a right arm, her choice, and she can choose to either burn herself or cut herself, and when she does so, a bandage appears. In the older version, the arm actually bled and burned, and they've decided to backtrack on that, which is probably a good thing. But again, not for all people. 50% of my clients hate this app, but 50% say that it really made a huge difference in giving them the skills to cope with their feelings. Finally, Georgie decides to get some counselling. So the app basically offers her a smorgasbord of choices. She can either go to eHeadspace, and she can basically do some online counselling with very, very experienced people. She could go to the kids' helpline email system as well, which she can basically get online counselling from them, or she could just pick up the telephone and talk to a human being on 1800 55 1800, or she could basically go and visit her local GP. This app ideally would send her to youth-friendly GPs in her area, probably at a Headspace near her. So again, using geolocation technology, we can actually guide young people to the support which is best suited for them, remembering that they're not good with Medicare cards, they're not necessarily really good with the money, they're not very good with appointments. There are a whole lot of reasons why you'd want to go to a Headspace as opposed to anywhere else. And g'day to all the people out there from Headspace. Keep up the good work. Of course, because this is a school-based app, white-labelled, she could also go to Mrs. Miller, who is in fact the school counsellor, and ideally this app might have a button on it where she can press a button and either speak to Mrs. Miller or make an appointment virtually, just to make it so much easier for her to use. Georgie actually has now got really quite severe suicidal thoughts, but in working with her clinicians, one of the things that she can do is she can get a digital safety plan from the wonderful people at Beyond Blue. And Beyond now is a first of a range of suicide safety plans that are currently available and downloadable. Don't know if you've seen this. The way I use this in clinic is I will actually get my client to download this onto their phone, and then what we will do is we will go through and customize her warning signs, her reasons to live, ways in which we can make her environment safe to be in, give her some ideas of things that she can do by herself, who she can connect with, friends and family she can talk to, and of course list her professional support network. So this is a very beautiful, clever app, very, very useful. Georgie eventually is prescribed medication. Of course, one of the big problems with young people in terms of prescribing the medication is that it works best if it's actually taken as prescribed. Some young people have very busy lives and sometimes they can forget. Sometimes they might take other substances at the same time, which would interfere with the efficacy of that medication. So what we know from the research is that non-compliance with psychotropic medication is in fact associated with poorer outcomes long term. So the app will recommend another app to her, strange name called Pillboxy. This is a pill reminder system, which I really love. I love its colourfulness, if that's even a word. I love the fact that she can customize the shape and color of the pill to the one that she's actually taking, and that it will remind her on time, even if her device is asleep. No Wi-Fi network is required, and it's available for iPhone and iPod Touch as well. So I think one of the great ways in which we can try and help young people to get better is the use of this very specific technology. Give it a go yourself. One of the best things, of course, about Happiness Central is that if Georgie wants, when she does go, the therapist, it might be me, it might be her GP, or it might be someone at Headspace, she will be able to download all of her information onto that professional's laptop so that that professional gets a snapshot of how she's been for as long as she's had the app, in terms of how many steps she's taken, her sleep, her mood, her anxiety, and maybe if she has been diligent, her caloric intake as well. So this to me is a real game changer when it comes to the provision of psychological services. Now, this app at the moment, part of this already exists, and I saw that we had some questions about this. If you haven't already, please Google the word Reach Out Toolbox, because this actually is a way that you can already get your clients to help work out their goals. And the Toolbox is a collection of health and wellbeing apps that again are endorsed by professionals and peer-reviewed, and it will recommend, like Happiness Central, the apps that the young person needs, and they'll be able to track their progress. What it doesn't do is it doesn't monitor and doesn't communicate in the same way that Happiness Central might eventually. All of this, of course, is in prototype and is in development. I can't tell you when this will be rolled out because that's in the lap of the funding gods, but I'm just telling you that a lot of these apps already exist. In fact, all of the apps and the web-based programs that I've talked about are available to your clients. And the nearest thing we can come to Happiness Central at the moment is, in fact, the Toolbox. So you should log on, you should have a go yourself. It's very important that before you talk to a young person about this, that you give it a go yourself. You can't be stuffing around with it. It looks unprofessional, and I think they would be much more grateful if you clearly knew what it is you were doing. This is broken up into a number of areas. The young people are encouraged to take a quiz. And what I'm doing at the moment clinically is, if I've got someone in my office who is fairly unhappy, we can do this together. We can take the quiz together. It'll take about a session to get through it, but you know what? It makes such a big difference if you can collaborate together, use the young person in a partnership to work on their well-being. Just can be quite extraordinary. So I end with a plea for you to have a look at the certificate in young people's mental health and technology. Remember, this is online. It's done together with the wonderful people at Orygen. In fact, it's on Orygen's learning management system in what Karen will describe to you as their campus. And it is a fantastic program. So we've got time, I think, for some questions, Karen.
We have lots of questions, lots of questions coming through, and probably more than we'll have time to answer, Michael. So I think people might find it helpful to be able to use your Twitter handle to get their questions through to you. Okay, so you can tweet me on MCG58. Of course, if you're not on Twitter, you're going to find that very difficult, but getting on Twitter is not very difficult at all. And if you don't know how to do that, just Google, how do I get on Twitter? And they'll run you through it. It's time to get with the program, people. Right. Okay. So this is where you'll find the certificate that Michael's been referring to on the Orygen website, but I think you can also get it on the Young and Well CRC website, so you can find it in both places. We would encourage you to have a look. It's a really innovative, world-first, getting people like us up to speed with the types of things that Michael's all over. So do have a look at it. It does have a cost associated with it, and we know that can be difficult in people's professional development budgets. So we wanted to draw your attention to 2 grants that we've become aware of recently, particularly targeting clinicians who work in rural and regional areas, because we know professional development can be very difficult to come by in those areas. So these grants might actually be helpful for you if you're interested in this certificate or in other professional development in terms of assisting with the costing. But can I just say, in terms of online professional development, this is $250 per module. It's incredibly reasonable. Not a lot. It's not a lot of money, and if you are in the least bit interested in any of the things that I've talked about today, this really takes you through it bit by bit. We have just updated the module, so it's absolutely up to date. Every 6 months it has to be, because of course the information changes. So look, if you don't have $250, here are some opportunities for you to get some research money. Okay, if you are interested in other training, drop us a line at training@orygen.org.au. We are able to run a range of training for you in your workplace, customised to what you're after. So if that's something that's interesting you can let us know. Might also remind you again that we've had some questions coming through saying that there was a lot of information about various apps that people wanted to remember and that they didn't record them all down. So check back in a little while on the Orygen website, because this webinar will be recorded. So you'll be able to watch the webinar again, push pause, make notes. Some of those apps that Michael was mentioning were amazing, and I've been trying to keep up in this space and didn't know of many of them. So come back and have a look, push pause, let your colleagues know. You can see them on the Orygen website.
And if there's a specific app that you want to know about, please tweet me and I will be delighted to respond to you. I know that we had a lot of people register for this particular webinar, but I'm very, very happy. I'm pretty passionate about this stuff, and I really want people to start exploring the use of this. In my own profession of psychology, I think we're still coming to terms with the ethical and legal ramifications of this, and one of the marvellous modules of the 4 modules actually explores the legal and ethical requirements in terms of the use of this stuff, and it's not as terrifying as you think. But again, another really good reason to log on to those 4 modules. So the first one looks at mental health problems in young people and the involvement of technology. The second one basically explores suicide prevention and self-harm. The third one looks at how to integrate technology into your clinical practice in far more detail than I've gone into. And the last one, again, looks at the legal and ethical things. It's a really well worth your time. Continuous enrolment, you can enroll now.
Okay, thank you for joining us today for this webinar. We hope you got something out of it. I'm absolutely positive you will have. Keep an eye out. We'll hopefully be running some more webinars for you as time progresses. And thanks for your time.